Tony Goodman is PRO for the Ministry of Health. But let me just tell you the story itself. Nurses at the Accra Psychiatric Hospital have given the management a 1-week ultimatum to pay them their 9 months salary arrears or risk a strike. The staff nurses say they had not been paid since they started working on September 2, 2013. Wow. Now, they also claim there was the rumor that government would only pay them 3 months instead of the full 9 months. The nurses continue to allege that they say they are still at work because of the assurances by management to help address their plight. And indeed, Chief Psychiatrist of the hospital, Dr. Akwesio said there has not been any formal communication from government concerning the issues raised by the nurses. But we here on News Desk have decided that we will get that formal communication via the platform. Tony Goodman is PRO of the Ministry of Health. He's joined me over the telephone. Hello, Tony.
Yeah, hello. Good morning, my sister.
Good morning to you, Tony. Tony, so the nurses can not only fear for their lives, but they have also not been paid 9 months.
Yeah, thank you very much. Not fear for their life, I don't know about that. But the policy is a new policy that has been introduced to at least clean up the payroll and also bring some sanity onto the government payroll. So it is just a new policy that says that you will be paid a back pay of 3 months after you've been employed, no matter the month you've worked. But when we find out from Ministry of Finance, they said you can come and prove that you've worked for 9 months, you've worked for more than the 3 months stipulated, and then you'll be given that back pay. So it is not a policy that is strict, but it's a policy that is there to take care of how people are being paid and how we abuse the system. It's just to bring some sanity into the system. So if you believe that you have worked more than the 9 months, you only go to the Ministry of Finance, where we all do our biometric registration, and prove that you've worked more than the 3 months, and you'll be paid.
But it doesn't come across as though this has been communicated to the nurses.
This is something that is coming from a different institution, and it has been there. I don't know what they want to be communicated to. If you have problems, you go to the right source and ask questions. You don't go and declare that you are going to go on strike or to demonstrate. You find out from the appropriate authority, and then you get answers. You don't just say that I'm going to demonstrate or I'm going on strike because I don't understand.
Very well, Tony. Now, does it mean that this call, because I get the impression that some calls have been made on government, doesn't mean that, no official call is being made on you as Ministry of Health concerning this matter?
Which official call? They demonstrated and presented a petition to the management of Accra Psychiatric Hospital. And when we find out some of the issues in their petition, we find out that the back pay, the 3 month back pay was there. And we've given this, your platform is one of the platform that I can also communicate to them, because this is happening not only in the health sector. It is a communique that has been issued by an institution that is not from the health sector. It is the Ministry of Finance directive to every public worker, not to only Ministry of Health. And we've when they started demonstrating, we've told them this, and they've now singled out that on their petition list and say that they will go on strike because of that. And I'm telling you that they should not go on strike. They should only go to Ministry of Finance and prove that they've worked more than 3 months, and they will be paid. So there is no cause for alarm.
I see.
When it comes to salary, we don't form groups. You have to go as an individual and go and prove your point, and you'll be paid.
I see. Tony, thank you very much for your time. Tony Goodman is Public Relations Officer for the Ministry of Health. Now, I think that the situation with the nurses has been solved. He says that if you can prove that you've been working for more than 3 months or up to the 9 months they are asking for, you should just go to the Ministry of Finance and have this sorted out. Well, we'll see what comes out of that when this gets to the nurses. You might want to stay out for a continuous conversation on this when we get in touch with the Accra Psychiatric Hospital. But just before I read some of your messages, some of your messages on this, I will just have to tell you this news coming in. Polytechnic students are staging a nationwide demonstration to pressure government to resolve issues which have left their teachers out of the classroom for nearly 3 weeks now. It's happening live in Kumasi, and our regional correspondents from the Ashanti region should join us in a bit with an update on it. But in the meantime, on Facebook, some of you have been commenting on the issue with the nurses, and well, I understand I have the Kumasi update already, so let's go over to the telephone and speak to our regional correspondent. And Mohammed Nuruddin is joining us from there. Hello, Nuruddin.
Hello, Kamini.
Right, so tell us what's been going on.
Well, the students of Kumasi Polytechnic have begun the demonstration that they have said they were going to embark on to register their displeasure about the lecturers' strike. They are telling me that this particular incident has also given them an opportunity to tell the government about their problems. You know, when a polytechnic student graduates from the polytechnic, they are supposed to have a working experience for about 2 years before they will get an admission into the university. And they are saying they are going to also petition the government on this particular issue, that students would have to stay in the house or have to work for 2 years before they will gain admission into university, and among other things. So they are now on the main, some of the they have now the Kumasi Metropolis, specifically at Edum Post Office, marching towards the regional, the RCT, to present their petition to the regional minister, Kamini.
Right. Nuruddin, thank you very much for that update. We'll get more on this on News Today at midday, and you don't want to miss out on how this ended with the Kumasi Polytechnic students who've hit the streets to demand the government brings their lectures back to the classroom. So now on Facebook, on the issue of the psychiatric nurses who've given the management, Accra Psychiatric Hospital nurses, who've given management a week's ultimatum to deal with their 9-month salary arrears. Atariga Gilberts from Bolgatanga says the management should heed to the call and pay these arrears for the nurses to continue rendering their services to the patients. Arrears should never be allowed to accumulate to that extent. 9 months is too much for a person to survive. Jefferson Quinn, who says this is wicked, 9 solid months without salary. And Lee Cohen says disgusting 9 months arrears pay. How are people living? And Juventus says that is the only language government understands. Well, I'll move on to Selim Duomekpo, who says the politicians are enjoying theirs. Don't waste time at all. Perhaps that's the only language government understands. Domfe Isaac says, well, no, I won't take that, unfortunately. Thank you very much for all your messages, all the same. And on News Today at midday, we'll find out from the Accra Psychiatric Hospital and its management if indeed management knew about this finance ministry directive that back pay will only be for 3 months and not any other months you have worked, unless you can prove, and why their staff is saying that it's given it a week's ultimatum for this. We'll get a reaction on what the Ministry of Health has told us here on News Desk. But what went